There's a rather substantial anti-science bias in this country, the kind of things that get people to stay away from vaccinations. Those are the same mentality that don't believe authorities when they say that wearing a mask clearly decreases the risk. We've got to keep hammering that down, but it's...
Hi, I'm Rebecca Brann, and I was lucky enough to be invited to a health conference with Dr. Anthony Fauci as a keynote speaker. Let me show you what he said.
Tools we have right now are public health tools until we do get a definitive intervention. So when you look at we have to take a look, at the fact that we have a very large country, and it's a very heterogeneous country, and we never have anything with this that's unidimensional, because things that are going on in a place like metropolitan New York City versus Casper, Wyoming versus New Orleans versus Chicago, all of them have had a certain degree of involvement, and some have done very well, some have come down, some still are at a low level, and now even some right now, disturbingly, particularly in the Sun Belt, are starting to go up. So in direct answer to your question, with that as a background, we don't necessarily have to have a resurgence of cases as we open up the country for the economic reasons and reasons of trying to get it back on track. Whether or not that happens is going to depend on what you've asked. What is the system we have in place? The manpower, the operating system, the testing to identify, isolate, and contact trace. Because even cities and regions and states and counties that have done well, as you start to tiptoe appropriately into opening, you will see additional infections. There's no doubt about that, because the infection has not disappeared. We haven't gotten rid of it. It's around. It's how our health system responds to it, both in containing it from spread and being able to take care of people who actually need hospitalization, even those who need critical care. So health system is intimately connected with everything we can respond, whether it's helping people who are infected to not get into a situation where they're not allowed or don't have the opportunity for good care, or being able to detect the people who are infected and might be inadvertently spreading it throughout the community.
He spoke at the virtual summit on health system recovery from the COVID-19 pandemic to a very large audience virtually. These were all health professionals that signed up for this very big conference. There were a dozen of other speakers, all at the top of their field in the health profession. And the exhibitors of this conference are the biggest names in the healthcare industry right now. I'm just going to scroll through so you can see who's behind this conference. The conference was a 4-day conference and included all kinds of topics about COVID in the healthcare setting.
There are 3 components to it. One is diagnostics. We need a rapid point of care, highly sensitive, highly specific diagnostic that we can essentially have so much of it that we'll never ever have to talk about a shortage of any diagnostic ever again.
On the subject of testing for a bit longer, do you think we are now getting close to conducting the amount of testing in areas across the country that we need to be doing, or do we still have a long ways to go toward that?
No, we don't have a long ways to go. As a whole, the group, we're much, much better off than we were a few weeks or months ago. We have now a total of about 24 to 25 million tests were done. We'd like to get it up to 1 million tests a day. I think we can do even more than that. And by the time we get into the middle of the summer, I think we'll have as much testing as we need. There's 2 aspects of that, Susan. One is the test that you're using, and 2, it's what the test tells you. So there are many tests out there, not all of which have been validated by either the FDA or the NIH. But let us assume
regarding
you have
antibody
a validated
testing.
Test, which means it's sensitive and it's specific.
For antibody
Given
testing.
that, when you look at what you see in people who have recovered from coronavirus disease, there's a great deal of variability and somewhat still a little bit puzzling. We have some people who've recovered who have very, very low titers of antibody. What does that mean? Does that mean they have cell-mediated immunity that help get them over it? Or Did they have a lower level that happened to work for them? There are some people who have varying degrees of titers, high titers, medium titers, low titers. We know that if you extrapolate from what we know from other infections, that when you recover and you have an antibody response, it is highly likely that you are protected for a finite period of time. What we don't know about COVID-19 is A, how long that protection is. Is it measured in months or is it measured in years? Coronavirus infections that are non-COVID, the ones that are the common cold, protection usually lasts from 6 months to a year. If you get infected with this, hopefully it's several years, but we don't know that yet. And we don't know the difference between the level of the titer and the degree of protection. So broadly speaking, yes, you likely are protected, but a test doesn't really definitively tell you where you are in that spectrum.
Need to do to essentially get the point across more broadly that this is really an aspect of the social compact. We wear masks because we want to protect each other. How do you think we drive home that point?
Well, I think we have to just keep trying to drive it home over and over again and do it in a way that has a variety of people talking about it, not just me. We need people who the community trusts. We need people like celebrities in the sports world, celebrities in the entertainment world to do that. As I mentioned before, I think the day before yesterday, which got some press about it, that there's a rather substantial anti-science bias in this country, the kind of things that get people to stay away from vaccinations. Those are the same mentality that don't believe authorities when they say that wearing a mask clearly decreases the risk. We've got to keep hammering that down, but it's got to come from a number of sources. So hopefully we'll be able to get that message out. It really does make a difference. And you made a very good point that people don't appreciate. Just because younger people in general don't have as severe consequences of infection as the elderly and those with underlying conditions. Two things about that. One, some young people do really get severely ill and die, so you're not completely immune. It's less likely, but it happens. But B, you've got to look at it in a different way. Not only do you have responsibility to protect yourself, but you are part of a society. And if you get infected, even if it doesn't bother you, even if it's asymptomatic, the chances are that you are going to pass that infection on to someone that's vulnerable. So if we're going to contain this outbreak, we have to all be in it together. We can't have some people who don't care about it and are spreading about it, and then those who are suffering from it. You got to realize you're part of a continuum in society, and you have a responsibility, a societal responsibility, to do your part in helping to put an end to the outbreak. And the best way you can do that is by not getting infected yourself. I was on the phone with our United Kingdom colleagues who did the dexamethasone study, showing that prednisone type drug, which in this case was dexamethasone, they're all glucocorticoids or steroids. When given to individuals on ventilators versus needing oxygen versus not needing oxygen, they showed very clearly that it diminished the deaths in individuals with advanced disease, but not in individuals who didn't have advanced disease. So already you have two interventions. There's another whole group of them lined up to go into randomized controlled trials. And then finally, there's a vaccine. Again, all the years that I've been developing vaccines, I've never seen this unprecedented cooperation between multiple companies using NIH resources, using NIH funding to go from a concept right into a clinical trial. In July, we plan to start the first of maybe 3 or 4 phase 3 trials. One will start in July, one will start in August, one will start in September, and then October. And hopefully by the end of the year, the beginning of 2021, we will know whether the vaccine is safe and effective. I can't guarantee that it will, but I can feel reasonably confident that we will know if it works or not by that time.
I'm Rebecca Brand. Thanks for watching.